Okay, so this is thank you. So this is Mr. Gilchrist, okay, and he's agreed to be filmed in this very strange time in the middle of the COVID crisis. If he doesn't mind me saying, he's 73 now, 74 now, okay, and was on the surgical waiting list until last week. Now we don't have surgery available. He's got symptomatic severe aortic stenosis, and so we've diverted him towards a Tavi pathway. The beds in the hospital are very short, and this may be the last Tavi we do for a while. We've given it not to our patients who are set for balloon valvuloplasty who are older. We've moved those off to medical therapy, not the Tavi patients who are obviously slightly older than Mr. Gilchrist, who we've moved to a balloon valvuloplasty or nothing, but to the surgical patients who are obviously in much better shape. We're about to have surgery, but that is no longer going to be possible and unlikely in the next 6 months. So, Mr. Gilchrist, I know we've had a number of conversations about this. How are you feeling about that?
Nervous.
Because of course you were lined up for an operation. Everyone said the operation is the best thing.
Yes.
And now we've changed our plan.
Yes.
And the best available thing is Tavi. But to reassure you that Tavi in someone between 70 and 75 is fairly commonplace in the rest of the world. It's not our UK protocol, but protocols are all out of the window at the moment. So I'm just going to take you through the consent process, which obviously we've had a chat several times. So the procedure will be done by me. We're going to do a transcatheter aortic valve, which is also called a Tavi, which is a pipe coming up from the leg up to the heart to place a new valve in position. Okay, you already have normal arteries, we know. The benefit is reduce your symptoms and also your prognosis, because of course in the midst of all of this, if you have symptomatic severe aortic stenosis, it's a bit like having cancer. There's a sort of 50% 5-year survival. So I think what we're really talking about is doing something that helps your symptoms but also makes you live longer. So I think that's what we'd want to try and do. I would quote a 5% risk of complications, which you do with all our standard Tavis, and that includes unfortunately death, stroke, heart attack and bleeding. So there is a 10% chance of a pacemaker. I think realistically for you it's slightly lower than that, but we need to be aware that there's a small pacemaker risk. So the pacemaker, the conduction system of the heart is very close to where the valve is. Whether the surgeon does it or we do it, we can sometimes impair that conduction system, and so a pacemaker can be needed. Okay, I think for you the chance is realistically probably about 5%, because you've got young protoplasm, there isn't a lot of chalk in the area just below the valve, and the ECG starts as completely normal. But there is a small risk that we need to be aware of.
Let's keep our fingers crossed.
Oh, absolutely. So of course the real conundrum here is that because of COVID, we want you in and out of hospital as fast as possible. So actually, unusually for us, you came in this morning, and you're going to have your procedure. It's now lunchtime, and the idea would be you go home first thing tomorrow morning. Okay, so if everything goes well, that's exactly what we're going to be doing. Okay. The other thing that we're dealing with, of course, is that ITU beds are very, very precious. Okay, I must say I haven't sent any of my patients to ITU for some time, but it could happen, and in that eventuality, we'll have to hunt around for that bed at the time. Normally, we have pre-booked some. But there is no pre-booking because of the COVID crisis. Okay. Do you have any questions for me?
No, only that, as I said earlier, I'd like to be as far away from this in terms of anaesthetic as I possibly can. And I understand it's a local anaesthetic, not a general anaesthetic.
It is. I mean, our protocol is that we have an anaesthetist in the room with us whenever we're doing a Tavi. Not every centre has that. The beauty of it is that we can drift you as close or as far to me as you like. Okay, so I do like a chat, so we would be chatting through it were we given the full opportunity, but actually if you're very nervous or anxious, then actually we can float you away without needing to put a tube down your throat.
Thank you.
Okay, fantastic. So if you're ready, it's a local anaesthetic procedure with sedation. We will get your signature. And I should say that, of course, your wife is fully on board with this. She's your next of kin, and so it's just right here. And so she's aware of the pros and cons. In fact, she's quite pro having this done, isn't
Yes, she was. She felt it was the best thing in the circumstances.
I think that's right, and I must say I would agree with that. Okay, and so your referral to me came from our surgeons. So Mr. Anderson, when his list was decimated by the virus, sent you in my direction to say, look, I think we need to do something, and we can't wait 6 months. Okay, so we're not allowed to shake hands because of the COVID crisis, but I think what I can say is that I'm hoping for a real success.
Thank you very much.
Okay, so this is straight after the Tavi procedure, which thankfully has gone very, very well. What did you think of the Tavi?
I thought it was an amazing experience, both from a point of view, if I could detach myself from the operation to viewing what happened in a surgical way in a medical room. And also I was astonished at the ease of passage. Absolutely amazing.
So very good. Well, partly that was because our anaesthetist Prasad had got him on a lovely plane with propofol and remifentanil. Not asleep. I was able to talk to him, tell him when I was going to push and pull. But he's actually done very well from the Tavi, and my hope is that he'll go home first thing tomorrow morning. It's coming up to 1:30 now. We finished the Tavi about 15-20 minutes ago. He'll go up to the ward, be monitored overnight because that's our protocol. Although I know some people would say, if he's 4 hours later, the ECG is fine, why don't you send him home? We haven't quite got that protocol yet. So this is a gentleman in summary who was on the surgical list. There is no surgery happening at the moment. We did a quick CT scan because we can. He was suitable for Tavi. He had informed consent, which I think is the challenge here, when his mind is set on surgery and we convert it to something completely different. But I think in reality, between 70 and 75, if he demanded Tavi, we probably would have given him anyway to him even before this COVID crisis, and he's actually done very well. I'm hoping we'll both survive the crisis.
Well, thank you very much for all your endeavour, your time, your talent, and your explaining everything. It was really brilliant.
Thank you.